Welcome to the Compliance Perspectives podcast. I'm Adam Turteltaub from the Society of Corporate Compliance and Ethics and Healthcare Compliance Association. Joining us today from Boston is Matt Michela. Matt is the CEO of Life Image, and we're going to be talking about patient access to imaging data. Matt, first, thanks for taking the time to talk to us today.
Well, thank you, Adam. Appreciate the opportunity.
Oh, our pleasure too. Now, from my understanding, there's some new imaging interoperability requirements. What are they, and what should provider systems do to comply with the new rules?
Okay. New rules, which have been promulgated by the Office of the National Coordinator for Health Information, otherwise known as the ONC, right, issued some new rules this year that defined really 8 standard data elements that need to be included. That's called the U.S. Core Data for Interoperability, right? So these rules basically mandate that a set of information that include things like pathology reports and diagnostic imaging issues asked about, and the corresponding narrative, lab, et cetera, have to be made available upon request to patients and other providers here, and that it must be done in a way that uses industry standard kind of APIs, which they call application program interfaces, but they're basically technical standards that all organizations must meet that will increase access to this information. And so this is the first time really that imaging data is really included in required data sets. And that's important because imaging has historically been the most kind of non-interoperable, very hard to access type of medical data. And it's really materially and clinically significant for a wide range of medical treatments and diagnosis. These new rules are really driving, a cultural shift at the practice level, whether you're small providers or work in very large hospital systems, to include, right, imaging and other complex types of clinical data along with the patient's history. And so there's a wide range of activities that providers have to do, working with their technology vendors to make sure that they're ultimately in compliance with these new rules and these new standards coming up to be available here in this current year.
So obviously organizations are going to have to comply with these rules, but why is it so important in general for patients to have complete ownership and control of this data?
So I think what patients have always known, and providers have been very slow, right, to acknowledge here, is that increasing patient data access really empowers patients and gives them better control of their health experience here. So whether it's a patient who has to physically travel to an office to get a CD of their X-ray or an MRI so that they could then go on to meet with a specialist to review, or it's patients that are prescribed drugs where they've got contraindications and the drugs interact together in negative ways, where if you don't have access to that information, you can really be harmed here. And so patients understand this, and now these rules really start to enforce that across the board. And there's been studies done, right? One that I point to all the time is a study that was done recently by UT Austin that recognized that when you give patients access to their medical information, that had resulted in a 28% reduction in hospital visits, a 10% reduction in readmission risk, substantial cost savings because of these decreased hospital visits here, and better compliance by patients with treatment plans and protocol. And so I think what the industry is really recognizing is that when you can get to interoperability and giving patients access to their own data, this is going to really curb and reduce duplicative imaging and testing, which costs the system and the patient and insurance companies precious time and money. And in episodes where you have something like COVID occurring here, providers on their own don't want to be handling physical media given the risk of infection. And so the historical way of patients going into hospitals to get medical imaging on CDs exposes the patient, exposes the provider, exposes everyone along the way with really unnecessary risks that interoperability can resolve.
And we've certainly seen people being much more hesitant to go to doctors' offices to begin with a lot of adverse medical consequences because of it. Now, you talked about the UT study. You did a survey yourselves recently on imaging data sharing. What were some of the highlights from that research?
So earlier this year, we did a study with 1,400 or 1,300 patients, on imaging, and what we found was actually, quite striking, right? We found that more than or approximately 40% of patients, in order to acquire their imaging, had to physically go into their provider's office, and they had to submit, paper requests for those medical records, right? That, of those requests, right, more than 41% had to go physically and pick up those records then as a second event and pick those up in person. 24% of the time, the records could be sent to another provider, but then not given ultimately to the patient. And what we found was that really in the high teens, but less than 20% of records were ultimately delivered through some kind of electronic means, even though a great number of patients, 66% of them, have access, right, to a patient portal. We found only roughly 13% of them actually use the portal itself in order to acquire their information. So, I guess another piece that was striking for us is that when those patients who physically had to go, had to fill out forms, had to go a second time, got their records, 40% of them or so had to receive them on a physical CD, and shockingly for imaging, almost a quarter, 25% of the patients actually received their records on physical film itself. Now,
Wow.
all of this is unnecessary, right? Companies like LifeImage have been, digitally transferring, exchanging, and providing access to medical imaging for, 13 years now. This is available, widely available technology, and is being used by hundreds of thousands of providers a day, in the US. But nevertheless, patients have not been involved and engaged here, and are, have historically been forced to jump through all of these hoops, which really degrades the care and increases the cost for everyone here. So those are the kinds of things that, with the support of the ONC, the rules and future compliance efforts, we hope to eliminate for the betterment of the system and patients themselves.
Now, we've talked a lot about sort of the arcane older systems that we use, and we've talked about how that's had a unfortunate nexus with COVID and people's hesitancy to want to either come into medical providers or anyone's desire not to have to actually handle physical media. How can hospitals and health systems prepare for the new normal post-COVID?
Understood. So COVID, right? If you look back, right, several years the government through the ONC has been promulgating, right, these new rules coming into effect. They've been slightly delayed, right, for implementation because of COVID, but nevertheless are going to be implemented, and there will be compliance and enforcement on the back end of this for providers and technology vendors that don't comply with making the standard data set available in an interoperable standard way. But what COVID-19 really did is it, I think, provided a wide range of examples to a wide range of people that healthcare has really taken far too long to advance and digitize and virtualize care. There was a study or data reported by the CDC a few months ago when we had roughly about 124,000 COVID-19 cases were reported, and of that group at that time, right, less than 6% of patients upon presentation and diagnosis for COVID had data available, right, pertaining to any of their medical history or underlying health conditions and risk factors. So patients are literally going out into the wilderness, being treated and evaluated and treated for a disease that we know has a wide range of systematic impacts, where patients with pre-existing medical conditions are tremendously more at risk and exposed, and they're being treated, in ways where all that information is completely unavailable, right? Terrible quality care. And I think across the system, people recognize the risk with that, which means, right, which is interesting, that the industry is now starting to embrace, not just because of the government rules, but because of this experience they've had in COVID, that interoperability and access to medical information is essential for everyone. So when we talk about providers and what they should do next, they should work with partners that they understand, that they know, partners that have an established track record in focusing on interoperability, not just in this current period, but here over time. Do your homework on your vendors and recognize that it is a partnership working with your technology providers where you've got to be clear with what you're trying to accomplish so that they can provide for you the solutions that ultimately optimize your experience.
Well, it's, I think, going to be an interesting time when this is over to see what sticks, what changes, and also as people realize, how much more data we actually need. As you mentioned, COVID is a very complex disease. It's having a lot of impacts. There seem to be a lot of factors which affect who gets it and how badly. And the more data there is available, the better able, both physicians and other medical practitioners will be to treat it, and as well patients be able to walk in the door and be able to red flag things.
Before we close the net, I'll comment on that, right? Because I believe you're completely right. But there really is no end to the types of data that is required to solve these complex medical problems, right? We talk about big data. We talk about all sorts of medical data. We think about a COVID, it's perfectly fine. But what we find is that accessing data such as the temperature that people keep their homes at, which can be measured now through digital means and put to the cloud, is actually an important piece of healthcare data that can influence how you would diagnose or treat someone that has asthma, as an example, or respiratory issues. So when it comes up to talk about data, and another time, perhaps when we got more time, we could talk about this more deeply. With the computational power that exists here in this century, the more data we have about our life experiences broadly will help us influence how we diagnose and how we treat these medical conditions as science and AI becomes far more sophisticated.
Wow, it's fascinating. And we'll certainly take family thermostat battles to a new level. Well, Matt, thanks for sharing your perspectives with us. I want to thank all of you for listening. I'm Adam Turteltaub from SCCE and HCCA. I hope we were able to expand your compliance perspective.